Well, the mRNA vaccines, we know from COVID, don't work against upper respiratory infections. They don't work very well, let me put it that way. There are two problems with them. One is they target a single protein, which drives what's called antigenic shift. If it drives the virus to mutate, and it actually can prolong the pandemic. And we saw that during COVID. People took shots, mRNA shots for the original COVID variant, and immediately mutated into the Omicron virus, to which the vaccine was ineffective. And that's what it does. And the other issue is that the way that it distributes in the body, the way that it migrates in the body, there's no control over it and no predictability. So it goes to every organ. It turns your body into an antigen factory where you're manufacturing antigens. And different people need different loads of antigens. And in a regular traditional vaccine, the antigen content is very carefully controlled for that reason, because you can injure people. And we've seen now these epidemics of myocarditis and pericarditis, particularly in kids. And for upper respiratory, for some illnesses, mRNA vaccines may be very useful, and that would include cancers. But for upper respiratory infections, we canceled 22 trials for upper respiratory infections. But right now, we're developing a universal vaccine at NIH, which is a vaccine that addresses the entire phylum of viruses. And so it's a vaccine that mimics natural immunity, and it is effective against any kind of mutation. So it doesn't drive the virus to mutate, and it could be effective. We believe it's going to be effective against not only coronaviruses but also flu. And it's going to be a much safer and much more effective vaccine.